And welcome into this edition of ACAP Today for the month of June 2024. I'm Jason Parent with the Aroostook County Action Program. On this week's edition of ACAP Today, we're going to talk with two leaders here in the state of Maine and right here in Aroostook County who are working on a community needs assessment and how you can get involved in that. We're going to talk about that. We're going to talk about the significance of what assessing the community's needs, both from a health perspective and from other perspective in terms of what people are saying that is needed here to make our community, our state, a better place to live. We'll have that critical conversation in just a little bit, but first, as we always do, we're going to go to the news and information that you can use again for the month of June 2024. And we start with the news and information that you can use with this. Rent Smart course. We've been talking about this in the past. This is to help individuals become better renters, or for individuals experiencing homelessness or who are in need of housing, to connect with professionals about information that you can use about how to navigate working with a landlord and how you can be, in general, a better renter. The course is going to be offered. This course for the month of June is on the 3rd through the 5th between 10 and noon each day, and from 12 to 3 p.m. So they have a couple of different options there. It's going to be held at ACAP's Customer Service Center near Walmart in Presque Isle at 771 Main Street in the conference room there. Again, it can help you learn new skills to build positive relationships with landlord as well as your neighbors, gain confidence in your ability to find and maintain affordable housing, and many other aspects of the rental experience. Now, if you aren't able to make the June course, or if this date's already passed for you, we do have other Rent Smart courses coming up in other months. We encourage you to contact us at 764-3721 extension 129, or email us at info@acap-me.org for more information on when the next Rent Smart course will be offered. Now, if you're a youth age 19 through 24 here in Aroostook County, there's a Gateway to Opportunity program that's looking for you. This is for leaders that are going to get together to partner with ACAP in Aroostook County to lead a team of high school aged youth in designing and implementing a youth-led community project. The individuals experiencing the Gateway to Opportunity course will oversee daily program and reflection activities to guide the youth in identifying solutions to community needs. So it's a really great opportunity for you to get involved with peer youth, and supporting them in navigating topics related to career readiness and the workforce. A great opportunity. In addition to that, if you're a youth age 16 through 18 looking to get involved in that meaningful experience, the run dates for that will be the 8th of July through the 15th of August, so perfect for the summer months here in Aroostook County. It's a 6-week, I should say, paid summer workforce program where the youth are paired with a local employer and work on a team to design a community project that centers the youth voice. So great opportunities for youth in our community all the way up to the age of 24, whether you're a team lead or a participant in the Gateway or GTO, Gateway to Opportunity here in Aroostook County. Please do give us a call if you know of a youth that would benefit from this program, or connect them directly with us. 764-3721 is our number. You can also email us at ACAP or the Opportunity Alliance. Information is there on your screen. It is a partnership between ACAP and the Maine Youth Action Network that's operated by our sister CAP, the Opportunity Alliance, in the Portland area, but happening right here in Aroostook County. Now, we are also, in addition to the Gateway to Youth Opportunity, looking for youth ages 16 through 21. The summer is a great time to do this, to really get involved in a 20-hour-a-week of classroom education, up to 40 hours of paid work experience. And you'll spend time with a career coach, receiving a number of helpful tips in that process. You'll receive counseling, get interview skills training, resume writing help, discuss career options. This is a perfect opportunity for youth, again, in our region, age 16 through 21, who are looking to really get a taste for a potential future career. These are real world experiences, they're work-based learning opportunities and job training programs. So give us a call here at ACAP. The number again is there on your screen, or email us at info@acap-me.org. Lots of opportunities for youth as the summer months are upon us now. So don't hesitate, because we're about to hit the middle of June at any point here as Aroostook County schools get out for the summer. And this is a meaningful opportunity for you to make a difference in your community and learn more about a potential future career opportunity. Now, speaking of school, we just talked about the end of the school year, but before you know it, in Aroostook County, the new school year will roll upon us, and that is why we are hosting our annual Back to School Bash along with a job fair. That's going to happen on Thursday, August 1st from 10 a.m. to 3 p.m. Now, why is this significant right now? Because we are asking the community for help to be able to fill backpacks for youth across Aroostook County to make sure they get a good start to the next school year. The backpack distribution and all of the activity will happen on August 1st, but in the weeks leading up to that, we are asking folks to help us by getting us school supplies. There will be opportunities to give at your local Walmart or to drop off school supplies at any ACAP office in Aroostook County. So more to come on that, and we look forward to next month on ACAP Today talking about this initiative a little bit more. But in the meantime, be considering getting your back to school supplies in so that we can make sure that we serve as many kids as possible as they head into a new school year. Speaking of a new school year, our theme continues. It's time to register your preschooler for ACAP Head Start. The ACAP Head Start program is provided to eligible families with preschool age children aged 3 to 5 here in Aroostook County. Meanwhile, there's a complementary program called the Early Head Start program, and that's provided to children from their birth all the way up to 3 years old, and even involves pregnant moms. If you're an expectant mom, you can potentially get into the Early Head Start program. Availability it's availability dependent and eligibility dependent. But it's a comprehensive early childhood development program that provides individualized education plans, yes, even for newborns, as well as health and social services, parent education and involvement, nutritious meals, and special services for enrolled children. You also have the opportunity to have your household work with a family coach, which is also very helpful in terms of parents planning for what their future might look like as well. Now, these programs are provided primarily to families with an income level at or below 100% of poverty guidelines. However, those receiving TANF, SNAP, SSI, or children in foster care and or families experiencing homelessness have eligibility availability as well. So please do contact us. The best thing to do is to check with us on eligibility, because we do have other programs like traditional childcare programs that we might be able to get your children into, even if you're not eligible for Head Start or Early Head Start. So do reach out, 764-3721. On this one, it's extension 224. You can also get more information, including an application, on the Early Care and Education section of the ACAP website. And we're going to talk now about workforce as children head back to school in the fall, or as adults are looking to sharpen their skills. Maine's Workforce Collaborative, which includes a Aroostook County Action Program, are continuing to hold online education sessions for job seekers or individuals who are looking to improve their employability. The tracks include interview tips and tricks, making career choices, resume and cover letter development, job preparation and retention, and navigating things like job search and the hiring process for individuals who might have a background. So we're certainly interested in folks signing up for these. You can go to the workforce development page of the ACAP website to learn more about the upcoming program opportunities. They're all offered remotely in the comfort of your own living room or workplace or wherever you are. And they're free of charge. So we encourage you to take advantage of these offerings statewide. We are also working with our prevention team on providing to the community supportive resources for those interested in quitting tobacco. We're going to talk about social determinants of health and health challenges, and certainly tobacco use continues to be one here in Maine. We'll talk more about that in our feature interview this month. But we wanted to let you know that you can contact and connect with ACAP for access to programs like the Maine Quit Link, My Life, My Quit, and our community educators who work readily with businesses and organizations across Aroostook County to help develop tobacco policies in our partnership with the State Department of Health and Human Services and others to provide these services locally here in Aroostook County for folks. Please do give us a call at 764-3721 or email us at prevention@acap-me.org if you'd like more information about how to quit tobacco products yourself, or if you're a business or organization that's looking to develop policies around tobacco use at your facility. And we want to also let folks know that as an employer, we here at ACAP are consistently looking for new talent across Aroostook County for all of our facilities. That is especially the case in our early care and education programs, where we are looking for a vast array of professionals that work with some wonderful children each and every day in our programs, again, across Aroostook County. Current openings include a teacher at the associate level or at the baccalaureate level, ed techs 2 and 3, and teacher aides. So if you are someone interested in working with youth, if you have a degree or if you're aspiring to be a degree holder or just want to know more about what the employment opportunities are at ACAP, give us a call. You can email us at info@acap-me.org. You can go to our website and look at the Join Our Team section. Now, of a special note is there's an up to $625 in early childhood educator workforce salary stipend available monthly for those who qualify. Again, $625 is the ceiling on that. There are lower supplements available for other educational professionals. You can ask us about that if you want when you give us a call looking for more information, but that's an additional incentive above and beyond the traditional salary and benefits that we offer here at ACAP, thanks to the state of Maine, as a result of understanding that there's a shortage of early childhood educators, and we want to make sure that we're getting our children off to a good start and their parents into employment situations that can be sustained. So please give us a call if you have any questions about open positions, or check us out online. And finally, if you are in need of some assistance at all at this point and don't quite know where to turn, we have a team of navigators here at the agency that can certainly help with that, whether it's employment, housing, looking at different benefit applications, food and wellness, connecting to other resources, or early care and education. Those of us here at ACAP can help you, whether those services are here under the ACAP umbrella or with other community partner organizations. We can help you navigate to those resources. So do give us a call at 764-3721 if you are in need of any assistance at this point and just don't quite know where to reach out or how to reach out for help. That's why we're here, and we love to hear from you. And that's the news and information that you can use again for the month of June 2024. I'm so pleased now to welcome to the program two individuals who have been working quite a bit on something that you're going to be hearing a lot more about in the coming weeks and months. And that is the Community Health Needs Assessment. And so I'm going to turn first and foremost want to thank both Heather Drake from the Maine Shared Community Health Needs Assessment team for joining us, as well as Jamie Chandler, ACAP's Chief Operating Officer, who many of you see here as a familiar face on the screen. Thank you both for joining us this month. Nice to have you. All right, I'm going to begin with you, Jamie, and Heather, you can unmute at any time so we can include you in this conversation as well. But begin with Jamie about sort of setting the context for us. Talk to us, Jamie, about what the coming community needs assessment is, how we got here, and what folks can expect.
Sure. So I'll talk a little bit about community action first. So every community action agency, we here in Aroostook County at ACAP are one of 1,000 across the United States that receive community services block grant funding. And as a recipient of that funding, it is a requirement that we do an assessment, a comprehensive assessment of the needs within the community to ensure that we are developing programs and services that are truly meeting the needs and addressing the challenges that those in our communities are facing. And so this community needs assessment occurs at least once every 3 years, and it includes an assessment of both the quantitative data, so looking at, we're pulling data from other sources like census or housing data and other research that has been happening either at local, state, or national levels. And then the unique part of the assessment is that we collect some qualitative data, and the qualitative data is where we're able to get really local and have conversations in the forms of focus groups, interviews, and surveys, where we're truly drilling down to see what is the experience of the people that are living in each of the communities. And so we take the results of that data and we identify what are the top. We look at both resources, so we look at what is available, what's going well within the community, and then where are the areas where there may be some needs or some improvements made. And then we take the results of that and we formulate, and it helps us to develop our strategic plans and develop programming to truly address the needs in the community, which is why no two community action agencies look the same, because they're all located in different places around the country, and the needs are very different depending upon the communities that they live in. So that's just a little bit of history. So what's really unique this year is that the Maine Community Action Partnership has partnered with the Maine Shared Community Health Needs Assessment teams, and Heather can give us a little bit of information on that. And so we are on the same cycle of assessment, and so we are coming together to pool our resources and our efforts to develop one statewide assessment to address both the community action requirements and also the hospital systems and public health districts requirements for needs assessments as well.
That's really exciting. So let's dive in there a little bit, Heather. Jamie sort of explained the rationale and the purpose behind the community needs assessment work that the community action agencies do. But as she pointed out, there sort of was a similar process with healthcare organizations across the state. So talk about what that has been about, what the goals of that are, and then how this alignment came together, and what we're looking at for this year.
Yes, happy to. And thank you for having me. So as Jamie pointed out, there's requirements that the CAP agencies need to do, and the health systems in the state, the Maine CDC need to as well. So every 3 years, the health systems across the nation are required, if they are a nonprofit under the Affordable Care Act and IRS, to conduct community needs assessments in a similar way as the CAP agencies. And then any public health department who wants to be accredited also needs to conduct community needs assessments. Their timeline is a little longer. It can be up to 5 years. But the Maine CDC has synced up with the 3-year timeline to join the partnership as well. And this has been in the making for over 10 years now, and it's started out a small partnership and has grown to expand. So now we have the 4 major health systems in Maine, which are Central Maine Healthcare, Maine General, Maine Health, and Northern Light Health, the Maine CDC, and then now the Maine Community Action Partnership, which is new. As Jamie was discussing, we have quantitative data. We have about 270 data points that we look at. And that has expanded with the addition of the Community Action Partnership coming into the fold. But what's great about that is we're now looking not just at health outcomes and health indicators, but what are some of the things that might be driving those health outcomes and indicators. So we've added things on transportation, housing, early child care, which some people might not realize is connected to health, but it really is. So we're being able to get this broader picture of what's happening in people's lives. And we've learned from what the CAP agencies did with their community needs assessment, and we've really made our qualitative community engagement much more robust this year. So as Jamie mentioned, we're doing focus groups, interviews. We'll have a survey that is slated to go out next week that will be open for the month of June, that we hope you will all take. It's open to anybody across the state, regardless of how you identify or where you work or where you live. But to really understand what's happening in people's lives that are contributing to their health that we can really address. And this partnership is beautiful because now we can address it not only on the medical side, on the state side, but now through social services and those really important wraparound structures that people need to be able to live healthy lives.
So very important. And Jamie Chandler, you certainly understand that from your perspective. I mean, in your previous life, you were leading and overseeing the day-to-day operations of the county's largest primary care facility. And then in your time here with the Community Action Agency, you could certainly see where the intersectionality of those two worlds kind of came together. So it really made you one of the key lead architects of this new plan moving forward. Talk to us about why this is so significant in terms of bringing things together for not only our community, but for the people that are served by both healthcare and social service organizations.
Absolutely. So I think it's important to understand that our social needs and our health needs are so interconnected. And so if you are struggling socioeconomically, if you are struggling, to be able to meet your nutrition needs, or if you're struggling with housing, it's causing stress that can or will lead to chronic health conditions down the road. If you're not receiving the necessary nutrition and developmental screenings as a young child, you're not going to be successful when you enter school, and that can and being successful when you enter school sets a trajectory for the rest of your life. And so all of these pieces are so intertwined. And one of the reasons why MECAP and the Maine Shared Community Health Needs Assessment partners decided to come together is that although our assessments previously were done quite differently, our results were very similar. And so it really demonstrated that coming together, not only for bringing our resources together and using best practices for the assessment, but on the other side of our assessment, as we're looking at developing our plans, our community health improvement plans, or our strategic plans, we're going to have more partners at the table to be able to work together to come at some of these challenges at different angles to really improve the health and well-being of the citizens that are living in our local communities and statewide.
Yeah, it makes a lot of really good common sense, Jamie. Heather, I'm going to come back to Jamie in a minute to talk about specifically how people in Aroostook County can engage in this process, but I want to hear from you what this process looks like in the next several months across the state of Maine. What can people expect? And how is this going to all roll out from the initial work that's sort of already underway to the point where we're going to be seeing the actual results of what information is being gathered, both the data sets and the voices of community folks?
Yes, it's a busy process. There are a lot of moving parts. And one of the beautiful things about this partnership is so much of the work is done by volunteers. So if you're participating on your local planning team, helping to recruit for focus groups or the survey, we really appreciate that. So we spent pretty much all of last year putting the plans in place through our community engagement committee and our metrics committee to really kick off this year, diving into community needs, learning from them, and also beginning our data analysis. So those two things are happening at the same time. We do partner with a vendor, Crescendo Consulting Group, this year, who does a lot of that work for us. So if you see different names when you attend a focus group, those are our facilitators. But right now we're in the process of conducting focus groups. We're doing at least one in each county to learn about those specific county needs. We are wrapping up our last statewide one this week. So we've done a few statewide focus groups with specific populations. We've looked at veterans, young adults, youth, women, the multi-generational Black community, and the LGBTQ plus community. And then we're also partnering with the Office of Aging and Disability Services to target our older populations and learn from them in an assessment that they recently conducted, and with Disability Rights Maine to learn more about the disability community in an assessment that they recently conducted. Because we know there's a lot of assessments happening, so we're trying to be mindful of that and not overburden populations. And then at the same time, we're also conducting key informant interviews. So these are either being conducted with people who represent populations. It might be with populations that we're not quite able to get to through focus groups. So a couple of our interviews are with people who represent either the unhoused population or housing, because it's not as easy to bring together those groups of people. And then we're also looking to have people do interviews on specific sectors that also don't lend themselves to a focus group. So that might be transportation and learning more about what's happening there, or food insecurity, climate. We're being really mindful of trying to incorporate that, especially given the events with weather-related activities that have been happening and impacting communities. And then, as I mentioned, we're doing a statewide survey. So will be happening beginning next week through June. So all of that information will be analyzed over the summer, along with those 275 data indicators, and we'll produce data profiles. So each county will be able to look at a profile and learn what health indicators and health outcomes and social drivers of health look like in their area. And we track it over time too, so we can see what's improving, what might not be improving. And then we'll have an overview of all of that community engagement data as well. So we'll take those two things and we can say, what is the data telling us, and what are we hearing from community, and how can those two inform each other? And in the fall, we hold stakeholder forums. Again, there's one in each county. We do two in Cumberland, given the diversity in their population. And we bring together stakeholders. We say, this is what we've learned based on this, based on what you know from your own experiences in your work. What should we be prioritizing? And the we being the health systems, the community action programs, the state, as we look to address health in Maine. And what comes out of those forums ultimately goes to our steering committee, which is made up of our signatory partners, and they have the final check to say what we should be looking at. Each county gets its own report with those priorities, with all the data, the community engagement information. And then we have one report for the state as a whole. And then each of our partners takes that information and they use it to inform their community health improvement plans or strategic plans. And those, our reports are issued at the end of March in 2025. So it's a long process. So we appreciate everybody's patience as we go through the year. And then each of our partners is on their own reporting timeline based on their fiscal year or their reporting years. And they'll have reports, for many of the CAP agencies, those are available on the websites. The health systems also put the reports and their plans under their community benefit reporting, and the state does as well. So it's all publicly available, as is the information we produce. So if you're just generally interested, you can go on our website, which is mainechna.org. Or if you work in the field, you can utilize any of the information if you're writing grants, developing your own programs. So because it's such a collective effort, we really try to make it available to anybody who might be able to benefit from it.
Yeah, and you've begun to allude to what happens next after the surveying work is done and a report comes back in, and I want to get back to that in a second. But Jamie Chandler, it sounded like that there were a number of opportunities in the process that is unfolding now for people in Aroostook County to engage and interact. So why don't you help us understand what those are and what that will look like here in the county in the process, and then after that we'll change the conversation over to what happens next.
Absolutely. So we do have two local focus groups coming up on Thursday, June 13th here in Aroostook County. The first one at 9 a.m. at the Caribou Public Library. And the focus groups will last for 90 minutes. And we are requiring that attendees register in advance for the focus group so that we know who will be in attendance. And we also will be offering a $25 Visa gift card stipend for those who are register ahead of time and attend the session. The second session on June 13th will be held in Holton at the ACAP office on Military Street, and that is being held at 2 p.m. And so two opportunities within Aroostook County for our residents to please come. We're focusing these focus groups, as Heather had indicated, our focus groups try and identify target populations. So for these two focus groups, we are looking for people of middle to low income. And that is basically the criteria that we are looking for participation in this group. So please, we will be promoting the registration links will be going out on our social media within the next few days, and we are hoping to get about 15 people to register for each of those focus groups. So certainly, if you're interested in an in-person conversation, that would be the venue for you. In addition to that, if an in-person conversation, or perhaps you may not qualify in that target population, we will also have the community survey that will be launched in June. And that is, our goal would be for every person in Aroostook County to complete that community survey. And so again, that will be a survey link that will be sent out through our media outlets. If you receive our newsletter, it will be going out in our newsletter. We will also have opportunity, if you do not have access to technology, you can stop into one of our ACAP offices and we will have paper surveys if that is a better option for you, and that it can be turned back in and then we can enter the data into the system. So lots of ways, and there will also be surveys available in different languages as well. So trying to make the community survey as accessible as possible, and so that we can have as many of the residents of Aroostook County and statewide, for that matter, complete that particular survey.
Thank you, Jamie. Now, Heather, you were alluding to, March 2025, when the reports will be available for county and for statewide entities to review. What are then, from your perspective, the actionable items that come from the robust data that we're working on collecting in the immediate time frame, and the participation of the voices that may be engaged in helping to assess the need to help move the work forward once the reports come in?
Yeah, so we'll have, as I said, a report for each county and for the state. Those go to each of our partners, the health systems, the main CDC, and the CAP agencies this year. And then they'll review those reports, look at the priorities, and then internally each hospital, CAP agency, and the state will come up with their own either community health improvement plan on the health system and CDC side, or a strategic or an annual plan on the community action partnership side. And so they look at the priorities, they decide which of those priorities they want to address. They're not going to address one, there needs to be a rationale for it. So, which could be as, maybe a community partner is working on it instead. And they're also able, if there's a priority that they see, to add their own. And they come up with a plan to address those priorities from 2025 until the next assessment. And so for many, because we know these problems, or some of these health priorities can't be addressed in just a 3-year span. They might continue on from one cycle to the next, building off what we've learned. And that's another opportunity for involvement too. If you're interested on the progress that's been made since the last cycle, each of the public health districts at either their June, July, August, we might have one happening in September, meetings, is presenting on the work of our partners that's happened since the last cycle. And that'll be posted online too if those meetings aren't accessible. And for Aroostook, that will take place on August 7th. And I think we're still waiting login information, but.
Excellent. Jamie, since Heather just spoke about Aroostook County in particular, the opportunity for healthcare organizations and social service agencies like ACAP to work together is certainly not something new. What are you hopeful about in terms of what this new collaborative effort, really going far upstream and looking at the needs together collaboratively, and where the intersectionality between health and social determinants of health will look like moving forward in the future, since the inception of this partnership, and how that looks in addressing some of the needs identified together moving forward?
Sure. So I think that what I would hope is that, one, it's an opportunity for us to just strengthen the partnerships that we already have existing, and to really see, as we were talking about earlier in this segment, it's not always clear how health needs and social needs are connected. And so I think through this process, we'll be able to really help to better define that interconnectionality between the two. And I would really like to see closer working relationships when we know that anyone who has been to a primary care appointment, we have a number of questions, and some of those questions include what's your housing situation, and how food, what does your food security look like, and safety in the home. And so those are pieces that, to be able to have a resource for those medical assistants or the staff that are asking those questions, and when the patients in the medical offices are identifying those needs, to be able to make those connections with the support agencies, whether that's ACAP or another agency that is providing those types of supports. And so I think just to bring those community partners together to identify where those resources are and how we can best take care of the people that are living in our community.
All right, so last question for both of you. Heather, I'm going to begin with you. What have we not talked about in this interview, or any messaging that you really want to underscore to viewers out there about the shared community health needs assessment work that's happening statewide, and this initiative in particular? Your last words.
Thank you. And thank you again for having me. I would just say we're in a learning process this cycle, I think, doing the community engagement more robustly than we have in the past. So I ask people to have patience with us if we miss a population or a person. We are learning, but with that learning, we're also looking for any feedback. So we want to engage communities in a meaningful way, and we're moving toward that. One of my dreams is to have more of a feedback loop. So once you help us with, taking surveys and giving your opinions and providing your insights and perspectives, we can come back to you in future years and make sure that we're hearing you correctly and that we're addressing what you've actually said. I know too often we ask people to provide their input and we don't circle back on what's happened. So that is something that we're striving for. And if you have suggestions on ways that we can do that better, we really welcome them, and want to be engaging community more throughout the cycle, and not just, when we want something, but we want it to become more of a bi-directional relationship too. And so I would just thank anyone who's participated so far or wants to participate. We really appreciate your time, because we know it's valuable, and we wouldn't be able to do this work without learning from everybody.
Great. That's great words. Thank you very much. And certainly look forward to hearing the voices of folks, not only about what the needs are, but about how the process can be improved and made better to reach the maximum number of people that we possibly can. Jamie Chandler, your final thoughts on the community health needs assessment and the great collaborative work that's happening, and anything we might have left on the cutting room floor, if you will, that you want to make sure people understand about the process.
Sure. So I think just that this is a new process. So community needs assessments are not new. We've been doing those for a number of years here in Aroostook County, but the new process is the partnership. And so I think that one takeaway that I would just want to reinforce is that with this partnership, it's really the purpose is to really look at the holistic health of our community, and that includes both the the medical, the mental, behavioral, and all of the socioeconomic components that come into it to make our community what it is. So first and foremost, just to understand that really that is the purpose of bringing us all together and the partnership in this. And then I would be remiss if I didn't again just emphasize the focus groups that are happening in June, on June 13th. So if you are a local Aroostook County resident, low to middle income, we would really encourage you to please, if you want an opportunity to participate in those focus groups, to please register and join us for those focus groups. And there will be some information going out on our social media outlets with a registration link for that. And then again, we want to hear from you. It's so important. We need the voices of the community members. So please take, we're doing some time testing now. I think it's, right around no more than, our goal is no more than 10 minutes for you to complete the community survey. So please take 10 minutes, complete the survey, tell us what's going well and where there are areas for improvement in our communities pertaining to health and well-being.
Excellent. Certainly want to hear as many voices and involve as many voices in Aroostook County and statewide in this initiative. Jamie Chandler, Heather Drake, thank you so much for your leading work around this very valuable process that we're all about to engage in as a community, and the worthwhile things that will certainly come from it. Again, your voice needs to be heard in this process, so please be on the lookout for ways that you can engage, whether that's in the focus groups that we talked about, or whether that's taking the survey, or however else that you might be able to provide us feedback in this process. We definitely want to hear it. Again, thanks to our guests. Before we leave all of you this month, we want to first, as we do at this point in the broadcast, bring you our highlight snapshots for the month of June. And June in Aroostook County is definitely a growing season. And so we take you up to Fort Kent, where the children and staff at our Early Care and Education Center there are engaged in the Grow More Good project. It's in full swing in the Fort Kent community, and you can see the youth there in our programs working with their team and working with a local provider of seeds and the like to be able to help ensure that the planting happens and now the growing is going. In our Grow More Good project up in Fort Kent, we thank all of the parents that have engaged in this project, certainly our staff and the community partners who have made this all possible. When we talk about the topic that we discussed today and community health and well-being, as Jamie pointed out, certainly here in Aroostook County, that starts from the ground up. And these youth are learning that firsthand in engaging and getting their hands dirty and making things grow up in Fort Kent. So we thank all of them for their work. Again, we thank our guests and we thank all of you for joining us for the June edition of ACAP Today. We'll be back next month. Again, I promised our July edition will focus on the back to school bash and the work happening to help children in Aroostook County get a good start to a new school year. We'll be back with that episode next month. Until then, have a great rest of the month of June, everyone. We'll see you soon. Thanks so much.